Oregon EMS Data System, EMS Agency Administrator Training, Agency Administration. This session is for EMS agency administrators. We'll show you how to administer the information for your agency, how to manage users and resources, and other features that you'll need to set up for your agency in Oregon's ImageTrend Elite data system. Finally, we'll discuss how to get support. This will be a hands-on session. We encourage you to shrink this video into one corner of your screen, and go ahead and log in to Oregon's ImageTrend Elite system yourself so that you can follow along. This is the login page for Oregon's ImageTrend Elite system. You can get to it by going to imagetrendelite.com/elite with a capital E. The organization ID is Oregon. Please log in with your own user account. If you don't know what your user account information is, please contact the Oregon Health Authority using the support information that we'll provide at the end of this training. I'm now logged in as an EMS agency administrator. The system features that we will review in this video must be completed by you before your staff can begin filling out patient care reports in ImageTrend Elite. We'll begin with your basic agency information. Go to the menu that contains the name of your agency and click on Information. The pages shown here collect basic information about your agency. You should fill out the information on this Details page as completely as you can. It helps us to understand the capabilities of your agency. Next, you should go to Service Area. You can set up a service area for your agency in a particular state. That will usually be Oregon, but if you serve other states such as California, Washington, or Idaho, you can add those states as well. You can see here that I've set up a service area in Oregon. Within this state, I should select the counties that my agency serves. It might be just one county, and that's fine. I should also select the census tracts and zip codes that my agency covers. Then I can save my agency service area information. I can click the back button to return to the original screen. The last tab is Statistical Year Info. This helps us to understand how many calls your agency has gone on in the past and the total size of the service area of your agency. You should at least report the most recent completed year. So for example, if this year is 2015, you should report stats for 2014. You may report stats for previous years as well. You can see here that I have added stats for 2014. And to add those stats, I simply need to fill in some numbers about my agency. I can fill those in, click Save, and go back. Next, let's look at user administration. You're responsible for managing the access of other users to ImageTrend Elite within your agency. You can manage users by clicking on the menu for your agency and choosing Users. This screen will show you a list of all users who currently have access to your agency in ImageTrend Elite. If your agency used Oregon's previous ImageTrend State Bridge system, then your users were migrated in fall of 2014. Otherwise, you'll need to add users to the system. Let's review a couple points about users before moving on. As an agency administrator, you have the EMS Agency Administrator role. Or, if your agency is also a fire department, you may have the Fire and EMS Agency Administrator role. Most people in your agencies, the EMTs and paramedics who go on calls and create patient care reports, should be given the role of EMS Service Provider. There are a number of other roles that you can issue to staff in your agency. You can give your medical director the EMS Agency Medical Director role. And there are roles for billers, for QA staff, for training officers, etc. These roles are set up so that each user has exactly the permissions necessary to carry out their job. The process for giving someone access to the system is as follows. First, you, as an administrator, should create each staff member's user account if an account does not already exist. You'll give them a user ID and a temporary password. Share that user ID and temporary password with the user. They'll use that to log in for the first time. And when they do log in for the first time, they'll be prompted to change their password to something that they select. So that's the process. Let's look at how it works. If I were to add a new user, I would click New in the top left corner. For this demonstration, I'm going to bring up the user account details for the training guest user. I can click on that user to bring up their information. On this page, I can fill out basic information about the user. At a minimum, I would want to put in their first and last name. On the Certifications tab, I can enter their Oregon State EMS ID. In order to be listed as a crew member on a patient care report, a user must have a state licensure ID. If you have personnel who go on calls and need to be listed as crew members, but they're not certified by the state of Oregon, it's still necessary for you to set up licensure information for those users. What we recommend is that you give them a state licensure ID that does not resemble Oregon's license IDs. And then for the licensure level, you can pick something appropriate. Again, every user that needs to be listed as a crew member on a call must have a state licensure set up, even if it means making up one for those that don't really have a state licensure. Next, let's look at account details. This is the page where you can actually give them access to the system to log in. You'll give them a user ID, and you'll set up a password for them. That will be a temporary password, and it will require reset when they first log in. Next, you'll assign their permission group or their role within the agency. Again, most users will be assigned the role of EMS service provider. Next, you need to mark their agency status as active and their system status as active in order to give them the ability to log in to your agency. Once you have set up the basic demographics, entered their state certification information, and set up their account details, you have now completed enough setup so that a user can log into ImageTrend Elite and use the system. If you have staff in your agency who need to be listed as crew members on EMS calls, but they never need to log into the system, you'll still need to go through the demographics and certifications areas of their user information, but you can skip the account details section because they'll never need to log in. On the other hand, if you have users in your agency, such as billers or other staff who never go on EMS calls and don't need to be listed as crew members, but they do need to be able to log into the system, then you'll need to fill out demographics and account details, but you don't need to put in any certification info for those staff. When I'm done working with this user, I can click Save to make the updates. And I can click Back to return to the list of users. Next, let's look at resources. Go to the Resources menu at the top of the screen, and let's start with Agency Locations. This is where you'll set up the locations for your agency, usually stations or ambulance bays. It could also be staging locations. You can click New to add a new location, or click on an existing location to edit it. Simply fill out the information about the location, at least its number and its name, and other information as available. Then you can click Save and return to the list of locations. Next, let's look at Facilities, which is also in the Resources menu. You'll notice that a full list of hospitals is already set up at the system level by Oregon Health Authority staff. So you can select or deselect each hospital by clicking on it and then choose to activate or inactivate it. We recommend that you activate the hospitals that you typically transport to and inactivate the others within your agency. That way, when your staff are filling out patient care reports, they have a short list of hospitals to choose from that represents the hospitals that your agency transports to. We recommend that you do not modify the information about the hospitals that came from the system level. We've already ensured that their information is correct and up to date. However, you can add facilities that are specific to your agency. For example, you may frequently transport to a particular healthcare facility that's not a hospital, or some other destination. You may frequently pick up patients from a certain location. You can add those locations at your agency level. You can click New to add a location. At a minimum, you'll need to fill out the name and make a code for that location. The code should not resemble an Oregon hospital facility code. So you could use the number of your agency with a dash and then a number for the location code. Whatever you'd like to do, as long as it won't be confused with an official state facility code. And then you can set up the other information about that facility. Once you've done that, you can click Save, and then you can click Back to return to the list of facilities. Next, let's look at vehicles. Go to the Resources menu and choose Vehicles and Call Signs. Here I see a list of vehicles in my agency. These are physical vehicles, physical apparatus. I can click New to add a new vehicle, or click on an existing vehicle to make changes to it. I can set up information about this vehicle, including the vehicle number which is required, and the unit call sign that is currently assigned to that vehicle. If my call signs list is empty, I can click Create to add a call sign. At the bottom of the screen, I can add information about the miles that have been accrued on that vehicle over the years. Below that, I can also add information about the typical crew configuration of that vehicle. Then I can save my changes and click back to return to the list of vehicles. Call signs are managed separately from vehicles. If I click Edit Call Signs, I am now looking at a list of call signs instead of vehicles. The way this works is that vehicles are physical apparatus, physical objects. They come and go over time as they're purchased or sold or discontinued use. Call signs are assigned to specific vehicles for a period of time. And those call signs generally get reused on different vehicles over the years. So you'll manage the two lists separately. But what you'll do is, as you set up each vehicle, you can record the call sign that is currently assigned to that vehicle. If that vehicle is sold and another vehicle is purchased, then you may reassign a particular unit call sign to the new vehicle. ImageTrend Elite has a number of other configuration features that may be important to your agency. You can set up computer-aided dispatch integration. For assistance with that, please contact Oregon Health Authority staff, and we'll connect you with ImageTrend. There are additional features in configuration. You can set up audit tracking reasons, dashboard features, and repeat patient lookup features. You can configure the way that Elite Field works. You can perform data exchange to import or export data in the system. There's also a migration wizard, where you can remigrate user account information from the Oregon State Bridge system. In the resources area, you can set up a number of other features, including leave of absence reasons, medical devices, medication and procedure permissions by certification level, shifts, signatures, zones, and districts. And in the Tools menu, you can use the Print Report Manager to create different layouts for printable patient care reports. Finally, you might want to check out the inbox, which is the messaging system that is embedded in ImageTrend Elite. If any of these features are particularly important to your agency, please contact the Oregon Health Authority for some assistance and training on those features. Here's how support works in ImageTrend Elite. You are the first level of support for the users in your agency, but you're welcome to call the Oregon Health Authority, and we are happy to assist you at any time. The third level of support is ImageTrend. In particular, we encourage you to check out ImageTrend University, which is an online system with many training resources to help you learn how to use ImageTrend Elite. Finally, for general questions about the NEMSIS data standard that we use, you can visit the NEMSIS website.